Good afternoon everyone. Myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about proprioceptive neuromuscular facilitation, that is PNF. So this is the overview, and today we'll discuss about PNF, its neurophysiological basis and some principles. Proprioception having to do with any of sensory receptor which give information about the concerned movement and position of body. Neuromuscular means involving the nerve and muscle, and facilitation is making it easier. So basically facilitating or helping our neuromuscular system. So proprioceptive neuromuscular facilitation is exercise based on the principles of functional human anatomy and neurophysiology, which uses the proprioception, cutaneous and auditory input to produce the functional improvement in motor output, which is a vital element in rehabilitation process of sports related injury. So the neurophysiological basis of PNF, Sharrington, concepts of facilitation and inhibition. We are having stretch reflex and neurophysiological phenomena. So facilitation, facilitatory and impulse causing the recruitment and discharge of additional motor neurons in the spinal cord, which increase the excitability of muscles, and weak muscles would be aided through facilitation. Inhibition means any stimulus that cause motor neurons to drop away from discharge zone and away from spinal cord, which decrease the excitability of motor neurons, and muscle spasticity can be decreased. Now we are having the stretch reflex. So basically it involves two type of receptors, muscle spindles and Golgi tendon. And neurophysiological phenomena, we are having the reciprocal inhibition and autogenic inhibition. So basically it is defined as an inhibition mediated by afferent fibers from stretched muscle on the alpha motor neurons supplying that muscle, causing it to reflex. It is the second mechanism which deals with relationship of agonist and antagonist muscle. So what are the uses of PNF? It can be used to increase strength, flexibility, coordination, functional mobility, and main goal is to facilitate the patient in achieving movement. Stretches as well as diagonals or rotation exercise pattern are used to improve ADL functional mobility and athletic performance. Mainly it is used in orthopedic rehabilitation, also in neurological rehab, and it can be used for any condition, and however the patient condition level may require modifications. So these are the basic principles of PNF. So first we are having the resistance, which is the opposing force to patient movement. So resistance provided during activity must be correct for patient condition and goal of activity, which is optimal resistance. So resistance is basically used to facilitate the ability to fork muscle to contract. It also increases the motor control, help patient gain an awareness of motion and direction, increase strength. Irradiation and reinforcement. Irradiation means there is spread of response to stimulation. Reinforcement means to strengthen by fresh addition, like making it stronger. And maximum resistance may be used to cause irradiation over a flow stronger pattern to weaker pattern, and from stronger group of muscle within a weak pattern of muscle within that same pattern. Next, manual contact, which stimulates the muscle. It basically synergistic muscle to reinforce movement, also promote trunk stabilization and indirectly help in motion. Also prevents the confusion. Touch or manual contact, which contributes to facilitation by stimulating the exterior receptors, and it should be purposeful, directional and comfortable. Stretch, which occurs when the muscle is elongated. So the lengthened muscle position is the starting position of each pattern, and stretch is maintained throughout the movement. All the component of pattern must be stretched simultaneously. So it stimulates the activity of muscle spindle. Any contraction of muscle on stretch will result in movement, and brain knows not muscle but of movement definitely. So this is the quick stretch. This is how it works. Next we are having the traction. Traction is elongation of trunk or an extremity. So applied gradually maintained throughout the movement and combined with resistance. So it stimulates the joint receptors, also stimulate the spindle stretch receptors and facilitates alpha motor neuron strength. Next we are having the approximation. So it is the compression of trunk or an extremity. Compression through a joint stimulate the joint receptors. It also facilitate the alpha motor neuron and stability. So basically it promotes stabilization, weight bearing, contraction of postural muscles, upright reactions, and resists some component of motion. Next we are having the verbal stimulation like commands. The volume with which the command is given affects strength of resulting muscle contraction, like louder command and strong muscle contraction is required. Softer and calmer when goal is relaxation and pain relief. So preparation, action and correction. So command used are hold, pull, push and relax. Timing is the sequence of motion. Normal timing is definitely of utmost importance because of the coordination and efficient motions from distal to proximal, which involves changing the normal sequence of motion to emphasize a particular muscle or desired activity. Thank you.